Hello, and welcome to my YouTube channel, or welcome back to my YouTube channel. If you have been following my true life story, welcome back, and I truly am really grateful for supporting my YouTube channel. I know most of you are in my position or wanting to do the home insemination through a donor bank, and I'm really happy and grateful for all your messages inboxing me. So you are more than welcome to ask me questions. And I'm like an open book. But I hope that all of you will have a success. But today I will talk about my follow up update with my OB. March 16th was my first ultrasound, and that would have been 2 months or 8 weeks. And that's when my OB didn't find any cardiac activity. And so, unfortunately, he wanted me to come back for a confirmation. And I went back on April 13th and to confirm to make sure, and there was no cardiac activity or progression of my pregnancy. I was more prepared because I have been bleeding with clots ever since I had saw him on March 16th. And it was on and off. It was first like a brownish discharge and then became more like light to medium to heavy, bright red blood with some clots. And so I have been experiencing the bleeding, and kind of knew for myself that it's happening. But I am okay mentally, emotionally, just because I cannot force what is meant for me. So I am grateful if God gives me another child. But at the same time, everything happens for a greater reason. So, in all reality, I am almost 43 in upcoming few weeks. And to be honest with you, I can't change my age. And that's one thing. But I know that I will never give up. And yeah, I just go with the flow. And if I am gifted for another child, then I will be more than welcome and be happy with all my heart and with my open arms, of course. So, but let me tell you my horrible experience. I'm still dealing with it, but at the same time, we have to move forward. You can be present with your emotions and acknowledge, and then give yourself some time to heal. But at the same time, you have to move on forward in a healthy manner. So, and take care of yourself emotionally, mentally, and physically, as always. But moving on, I went back on April 13th and to see my OB, in which he didn't find any cardiac activity. And he gave me a choice whether I want to take a pill that would expel all the tissues, or go through a procedure called DNC, which someone will sedate me and go in and get all the pregnancy tissues. So I went ahead as for myself what I would feel comfortable to go through and takes. It's called Cytotec. It's the pill, and I've never taken it ever in my life. It was my very first time, and I didn't really pay attention to what I would feel, but I just kind of like, okay, I'll do this, and for myself, it's more natural. to just take the pill and go through it on my own. So I went home that night and took it. And let me tell you, it is the worst pain ever I've ever experienced next to having a labor, okay? So taking the Cytotec, not knowing anything more about the symptoms, what I would feel, I actually was offered narcotics. It's called Tylenol with codeine by my OB, and I said, no, no, I am going to be okay. If I need some pain medicine, I'll go ahead and take an over-the-counter Tylenol, in which I don't take any pain medicine. So but he did prescribe me some Zofran, which is for nausea. It's an antiemetic. And I said, okay, I'll take that. So anyhow, mind you, I honestly didn't have to work the next day. So I went ahead and took it. And let me tell you, it woke me up at 4 in the morning. I was in severe abdominal pain. Like I literally don't want to move an inch to aggravate it and just to hope that it'll just all go away. I felt so sick, so nauseous, and I was just like throwing up. And I couldn't even really get up, but I had to just go to the bathroom and I just was so sick, throwing up. And so what I did is I was like, I don't even think I took Zofran for nausea, but I went back to bed and just hoping that it'll just all go away when I wake up. So I went back to bed and just put myself to sleep in pain. And sure enough, I woke up and the pains have subsided. And I was just like a bloodbath, right? It was just like I didn't even prepare myself. But if you are going to be in my position, please have some pads, all right, some chucks, to protect your linens and your clothes and everything else. So be prepared, be mindful that you are going to be in severe pain. It's just I can't even describe it. It's excruciating. It's like labor and labor and delivery kind of pain. But anyhow, went through it. And I had a follow up with my OB to make sure that I expel all the tissue. Now, I kid you not, I got up, took a full bath, and like two big clots came out. And I was thinking, okay, this is it. I kind of like just stood there and let the shower just like rinse me, right? And take it like everything. And so taking everything in as I stood there, and after I showered or took a full bath, I had literally emailed my OB and just messaged him how terrible this pill was, and never again would I ever take it again. So anyhow, of course, it's not the message that he would want to hear or for me to actually feel in pain, but I had to go back to make sure that I was able to expel everything on my own. And so I scheduled on April 20th, and unfortunately, my OB was, I think he was busy with some meetings. So I saw an NP who was just like amazing. She was the most like caring person, and I can tell that she was authentic. So, and she felt bad for me, of course. But anyhow, I saw her and took another ultrasound, and unfortunately, not everything was out. So I said, you know what? If you see something, please just like pull it out. And sure enough, she did that. And I just like bled. I was just like a bloodbath, like pouring, like, someone turning on the faucet and just like blood, right? And so, mind you, I have to work the next 3 nights. And I don't call in sick unless I'm dying. So, sure enough, I left there and I said, okay, I know how the side effect was so terrible, but I don't want to go through the procedure. So I'll go ahead and take another pill and just hoping that it'll just all clear up. So she was offering me a work note. I said no, I don't call in sick. I just started a new hospital, and I don't usually, they're really short. And I don't call in sick, and I like to commit myself 100%, 110% to work. So if it's work, right? So anyhow, I said no, it's okay. If anything, I work in the ER, and it's the best place to be, and it's so close to if anything happens. So the nurse practitioner was so concerned because I was already anemic, and I know to take my iron. And I said it's okay. If anything, the emergency room I work for in an ER, and she was so concerned because she wanted me to go to ER and get helped. And so if I need a blood transfusion, and losing too much blood, like soaking too much pad within an hour. So sure enough, I said, you know what, it's gonna be okay. I'll deal with it and take care of myself. It's gonna be okay. If I feel any symptoms, I will for sure, you know, do something about it, right? So I went home and just kind of like sat in the bathroom and just let it just flow, right? And hoping it'll just subside. And I have to get ready for work. So sure enough, took another full bath, and I said, okay. I went to work, and I said I'm not even gonna tell anybody unless I feel some symptoms, because I don't like pity parties. I don't usually like to tell people unless it's necessary, right? So anyhow, I had worked that night, and mind you, I worked the next 3 nights. So and the charge nurse is a guy, so I was like, you know what, I'm just gonna finish my 3 nights, and if anything, whatever, I'm just gonna deal with it. So sure enough, the next day I had to deal with my Amazon store, and thank God for my assistant, because I kid you not, it was like things that I don't really like to deal with, and he was there for me. So anyhow, I didn't sleep that day. I think few hours, and I usually take 2 second classes back to back in the morning after work. So I did that as well, and had to do things for this my Amazon store, which kept me all day. So I didn't sleep and had to go back to work again. Now, mind you, I still have my son and things to take care of outside of that, dealing with things. So I still have to like feed him and clean up, and get him ready, and cook for him. So a lot was going on, of course, and I was just like exhausted. I was truly exhausted. So I've been bleeding for like over a month, right? And I still have to deal with like home life, my son, and other things, that's going on. So there's really no time for any drama in my life, or any, there's always like jealousy. And I can't help those people. They have to help themselves, because I have other things that I have to deal with. Myself and my son, of course. But other than that, that's that. So anyhow, I had to finish my 3 nights, okay, and I plan to take this Cytotec again, on my day off, okay, and I was just expecting like a severe pain again. So I said, I would rather just be home and be miserable in pain than be at work and have to go home early, right? So anyhow, and you don't even know how much blood you're losing, and more clots, right? So finished the 3 nights, and I kid you not, the morning I clocked out after the third night, or the third shift, I told the charge nurse, I said, listen, we were short, but I literally like held on because I was bleeding so much that I had to finish my shift. I had to finish my job, and which I did. And he kind of just like, we both kind of like laugh about it, because it's like, okay, that's how loyal and committed I was, all right? So anyhow, went home, and I decided to take the Cytotec again the night of, just in case I'll be in bed, sleeping. And there was a mild pain the next day while I was doing my eyebrows, all right, getting my eyebrows done. I acknowledged it. I knew it was there, and I was like, oh, it's not that bad. So anyhow, I had to go back and see my OB, in which I saw him on the 25th of April, and it's like a big like we double checked and triple checked that everything was out past it. And I was just like, man, this bleeding has been going on since March, early March, and we're in May now, right? So anyhow, I was kind of like relieved. I felt relieved, and I said, okay, now it's just like dealing with things. My family doesn't even know that I was ever pregnant for the second time, just because I didn't want to let anybody know, my family, except for my sister, because she's somebody that I can actually tell everything. But because I didn't want to hurt any feelings or let anybody down with all the, happy news then sad news. So yeah, I just would like to tell them. I was gonna tell them when I was like at 3 months, but these things happen, and that's life. I cannot control what will happen, but I know that I can just move forward and take it a day at a time, a second at a time, a minute at a time, right? But I am grateful. I am truly grateful for the experience. And to be honest with you, I'm still bleeding since we're now in May 10th, since March 16th. So my OB said that it's going to take a few months or weeks to get back to my normal. So I can't even start the process again. I plan to do this after summer, after my son's birthday, because I plan to travel with him and allow my body to go back to its natural home and or cycle. But I am just gonna enjoy life with my son for now, and we'll try again. So the big question is, will I do this again? And to be honest with you, yes, I